In today's video, we're talking about 7 common mistakes that could be making your glaucoma worse, and you might not even realize you're making them. Glaucoma is called the silent thief of sight for a reason. It doesn't come with early warning signs, and once your vision is gone, there's no way to bring it back. But what if I told you that some of your daily habits, like skipping your eye, drop sleeping in the wrong position, or even drinking too much coffee, could be silently raising your eye pressure and damaging your optic nerve? The good news, these mistakes are avoidable, and at the end of this video I'll also share one simple habit that can actually help lower intraocular pressure naturally. So if you want to do everything possible to protect your eyesight and slow glaucoma progression, stay with me, because this information might just save your vision. Mistake number 1: ignoring early symptoms. Glaucoma is sneaky. It doesn't announce itself with sudden pain or obvious symptoms. Instead, creeps in and slowly and silently, which is exactly why it's called the silent thief of sight. Most people don't notice anything wrong until their vision loss is already permanent. A little blur here, some trouble adjusting to dim light there. It's easy to brush off. Maybe I just need new glasses, you might think, but what if those subtle changes are actually signs that your eye pressure is rising and damaging your optic nerve? The scariest part: peripheral vision loss, one of the earliest symptoms, often goes unnoticed. Imagine standing in a crowded room, but over time the people on the edges start disappearing. You wouldn't notice right away, right? That's exactly how glaucoma works. It steals your vision bit by bit without you realizing it until it's too late. And here's the harsh truth: once the optic nerve is damaged, there's no way to restore it. Unlike a smudged camera lens you can wipe clean, glaucoma treatment can only slow down the damage. It can't reverse it. That's why waiting for symptoms to become bad enough before seeing an eye doctor is a huge mistake. It's like ignoring chest pain until you're having a heart attack. By the time you take action, the damage is already done. Get regular eye exams if you're over 60, or if glaucoma runs in your family, you should be seeing an eye doctor at least once a year. A simple eye pressure test could literally save your vision. Pay attention to small changes. Do you struggle to see in dim lighting? Notice halos around lights at night. These tiny red flags could be glaucoma's way of warning you. Be proactive. The difference between catching glaucoma early and catching it late is the difference between preserving your eyesight or losing it forever. Think of it like car maintenance. Regular checkups keep everything running smoothly, but if you wait until your engine light is flashing, you're in for major trouble. And speaking of trouble, there's another mistake that's putting your vision at risk, and this one is completely within your control. Mistake number 2: skipping eye drops or medications. Let's be honest, taking daily medication isn't exactly enjoyable. It's easy to forget a dose, especially when you don't feel any immediate effects. And for some, the side effects of glaucoma, eye drops like stinging redness or dryness, make skipping them even more tempting. After all, if it's just one MISD dose, how much harm can it really do? More than you think. Glaucoma isn't like a headache that goes away after you take a pill. It's a chronic condition that requires consistent management to prevent vision loss. Skipping doses, even occasionally, allows intraocular pressure to rise, increasing stress on the optic nerve. Over time, these little misses add up, accelerating nerve damage and bringing you closer to permanent blindness. Think about it this way: if your doctor told you that a certain medication was keeping your heart from profit, would you skip it? Probably not. The same logic applies here. Glaucoma medication isn't about feeling better. It's about preventing vision loss before it happens. And here's where things get even trickier. Some people stop taking their medication entirely because they don't notice any immediate improvement, but that's not how glaucoma works. It's a slow battle of prevention. You won't wake up one day with better vision just because you've been diligent with your meds, but you also won't blind because you skipped one dose. The damage happens gradually, which makes it dangerously easy to overlook until it's too late. Make your eye drops part of a routine. Tie them to a habit you never forget, like brushing your teeth or drinking your morning coffee. Set reminders. If memory is an issue, set an alarm on your phone or use a pill organizer. Talk to your doctor if side effects are a problem. Some people stop using their drops because of discomfort, but there are different types of glaucoma medications available. A simple adjustment could make all the difference. At the end of the day, your optic nerve doesn't get a second Chance missing doses might feel harmless now, but over time they can be the difference between maintaining your sight or slowly losing it. And speaking of things that can silently damage your eyes, there's another major mistake most people overlook. Mistake number 3, poor blood pressure control. Blood pressure and eye health, two things most people don't think of as connected, but if you're not keeping your blood pressure in check, you could be making your glaucoma worse without even realizing it. And the problem isn't just high blood pressure. Low blood pressure can be just as dangerous when it comes to vision loss. Most people assume that only high blood pressure is a risk factor for glaucoma, and while it's true that elevated blood pressure can increase eye pressure, which speeds up optic nerve damage, low blood pressure is an even bigger problem. Here's why: your optic nerve depends on a steady blood supply to stay healthy. If your blood pressure is too low, it means your optic nerve isn't getting enough oxygen and nutrients, which can accelerate damage. It's like trying to water a plant with just a few drops. It simply won't survive, and it gets even more complicated. Many people with glaucoma are already on blood pressure medication, but certain drugs can lower blood pressure too much at night. This creates a dangerous situation where the optic nerve is deprived of oxygen for hours, increasing the risk of vision loss. Imagine squeezing a garden hose while also cutting off the water supply. That's what's happening inside your eyes. Monitor your blood pressure regularly. Don't just assume it's fine. Check it at home with a blood pressure monitor. Talk to your doctor if you take blood pressure medication. Some people may need adjustments to avoid dangerously low blood pressure at night. Support circulation with LIF-style changes. Moderate exercise, staying hydrated, and cutting back on processed foods can help maintain a healthy, balanced blood pressure. Might not seem like a big deal when it comes to your eyes, but keeping it stable can slow down glaucoma progression and help protect your vision. And while we're talking about things that can increase intraocular pressure, there's another mistake people make without realizing it: holding their breath during physical activity. Mistake number 4, holding your breath during physical activity. Whether you're lifting weights, carrying heavy groceries, or even bending down to tie your shoes, you might be holding your breath without realizing it. It seems harmless, but this small habit can spike your intraocular pressure, putting extra strain on your optic nerve and worsening glaucoma over time. This is known as the Valsalva maneuver, a natural reflex where you hold your breath while exerting force. It happens when lifting heavy objects, pushing furniture, or even during a difficult bowel movement. The problem is that holding your breath creates a sudden surge in blood pressure, which also increases eye pressure for someone with glaucoma. These repeated spikes in intraocular pressure can accelerate vision loss. Think of it like putting too much pressure on a fragile water pipe. Over time, it weakens and cracks. Exhale during exertion. When lifting, pushing, or pulling, make sure to breathe out instead of holding your breath. For example, if you're lifting something heavy, exhale as you lift. Practice controlled breathing techniques. Deep, steady breathing prevents sudden pressure spikes and keeps oxygen flowing to the optic nerve. Be mindful of your posture and strain. Avoid bending forward for long periods, and if you engage in weightlifting, opt for lighter weights with more repetitions rather than heavy lifting. Breathing may seem like a minor detail, but changing this one habit can help protect your eyesight in the long run. And speaking of things we do without much thought, there's something else that could be harming your vision: the way you sleep. Mistake number 5, sleeping in the wrong position. Most people don't think about how their sleeping position affects their eye health, but it can increase intraocular pressure and make glaucoma worse over time. Sleeping on your stomach or with your head too low puts extra pressure on your eyes, especially if your face is pressed against the pillow. Even favoring one side too often can lead to uneven glaucoma progression, meaning one eye may deteriorate faster than the other. If you have sleep apnea, the risks are even higher. Sleep apnea reduces oxygen supply to the optic nerve, increasing the chance of vision loss. Many people don't even realize they have it, but if you snore loudly, wake up exhausted, or experience frequent headaches, it's worth getting checked. A CPAP machine can improve sleep quality and help protect your eyes from procol. Further damage: to reduce risk, sleep with your head slightly elevated using a wedge pillow or an adjustable bed. If you're a procol or an adjustable bed. If you're a side sleeper, try alternating sides instead of always resting on the same one. And if you suspect sleep apnea, talk to your doctor. Treating it can slow glaucoma progression and improve your overall health. A good night's sleep isn't just about rest, it's about protecting your vision for the long run. Mistake number 6, excessive caffeine and dehydration. For many people, the morning cup of coffee is non-negotiable, but while caffeine gives you an energy boost, too much of it can increase intraocular pressure, putting extra stress on your optic nerve. The problem isn't just coffee. Energy drinks, certain teas and sodas can have the same effect. If you already have glaucoma, these frequent spikes and eye pressure can speed up vision loss over time. But caffeine isn't the only issue. Dehydration makes things even worse. When your body lacks water, blood circulation slows down, reducing oxygen and nutrients to the optic nerve. This added stress can weaken your vision even further. Many people don't feel thirsty until they're already dehydrated, which means their eyes could be suffering in silence. Staying properly hydrated is just as important as limiting caffeine intake to protect your vision. Limit caffeine to 1 or 2 cups per day and avoid high caffeine energy drinks. For every cup of coffee, drink a full glass of water right after to maintain hydration. If plain water isn't appealing, try herbal teas or infused water with lemon or cucumber. Small daily adjustments like these can reduce pressure on your optic nerve and help you maintain your eyesight for years to come. Mistake number 7, not protecting your eyes from UV light. You wouldn't step outside on a scorching day without sunscreen, right? Well, think of UV rays as sunburn for your eyes. Just like prolonged sun exposure damages your skin, UV light can worsen glaucoma, speed up optic nerve damage, and contribute to vision loss over time. And the surprising part, this doesn't just happen on sunny days. Even when it's cloudy, UV rays still reach your eyes and cause harm. The problem is that most people don't take eye protection seriously until they start noticing vision problems, but by then the damage is already in motion. UV exposure increases oxidative stress in the eyes, raising the risk of cataracts, retinal damage, and elevated eye pressure. Even blue light from screens can contribute to eye strain and long-term issues, making daily protection even more important. To safeguard your vision, wear sunglasses with 100% UV protection whenever you're outdoors. Choose wraparound sunglasses for extra coverage, preventing UV rays from sneaking in from the sides. And for added protection, wear a hat with a brim to reduce direct sunlight exposure. Protecting your eyes from UV rays is one of the easiest ways to slow down glaucoma progression and preserve your vision for the future. Bonus tip, a simple habit to lower intraocular pressure naturally. What if there was a simple natural way to reduce intraocular pressure and help your eye health in just a few minutes a day? Well, there is, and it's surprisingly effective. Gentle eye massage and relaxation techniques. Studies suggest that a light eye massage can help improve blood circulation to the optic nerve, which might reduce eye pressure. It's like a relaxing massage for your eyes that can improve fluid drainage, potentially slowing glaucoma progression. To do this, close your eyes and gently press the outer corners for about 10 seconds to stimulate circulation. You can also use your fingertips to make light circular motions around your temples and brow area. This will relieve tension and improve blood flow. Combine this with deep breathing. Inhale deeply through your nose, then exhale slowly through your mouth. This reduces stress, which is another hidden factor in raising eye pressure. Another great technique is palming. Rub your hands together to create warmth, then gently place them over your closed eyes. The warmth relaxes the optic nerve, and the darkness gives your eyes a much-needed break from constant light exposure. While this can't replace proper treatment, incorporating this simple habit into your daily routine could become a powerful tool in your eye care. Now that you know the 7 common mistakes that could be making your glaucoma worse, the question is, what you going to change today? Will you start being more consistent with your medication? Pay closer attention to early warning signs, cut back on caffeine, and make sure you're staying hydrated. Whatever it is, don't wait. Take action now, because when it comes to vision loss, there's no rewind button. Protecting your eyesight isn't just about treatment. It's about prevention. Every small change you make today can have a huge impact on your vision in the future. And let's be honest, your eyesight is one of the most valuable things you have. Losing it isn't an option. If you found this video helpful, make sure to like, share, and subscribe so you never miss another important eye health tip, and let me know